why we can't really use antibiotics for something.
If you, the pet parent, has had a dog with C. diff, you have to be very cognizant of that.
I didn't know it was going to become such a nightmare. Hey there, and welcome to the Legacy Biome podcast. I'm your host, Melissa Natanson, canine nutritionist, certified holistic pet health coach, and your pet's gut health advocate. Today, I am so very honored to sit down with someone who has had a profound impact on my pet health journey and on the lives of thousands of pets, Dr. Ruth Roberts. And if you don't know Dr. Ruth, she is an absolute pioneer in integrative veterinary medicine with over 30 years experience. She is also certified in traditional Chinese veterinary medicine and the founder of the original CrockPet Diet, a whole food, home cooked nutrition protocol that has helped countless pets heal and thrive. And the big one, she's also the creator of the certified holistic pet health coaching program, an accredited vet level training course, of which I'm very proud to be a graduate of, that gave me even more tools and perspective to help our little pets heal from the inside out and really get to the root causes. And Dr. Ruth, that's just what we're going to dig in today. We're going to go gut deep and start digging into these root causes, so we're not looking at symptoms anymore. No more symptom management. We got to get to the guts, right? Welcome.
Right on. Let's get to the root. And thank you. I'm so delighted to be here.
Well, I'm so glad you were the first person that I wanted on in our new Legacy Biome podcast, because you're so important. You're so amazing. I needed to get your input.
Wow. I appreciate all that. And that's the thing. I mean, what Legacy Biome is doing, and, any of the companies that are supporting pets to support pet parents to support their pets' microbiome is doing the heavy lifting for the rest of us.
Yeah. So this is interesting, and we're going to maybe dive into like the juicy parts really quick, but everyone, on my last podcast, I talked about my massive journey with Darla and C. diff. And at the end, we're going to get into a couple different things about why we can't really use antibiotics for something like C. diff anymore. We're going to talk about IBD, and we're going to dig into allergies. But Darla had a microbiome imbalance her entire life, and I didn't know it was going to become such a nightmare until she got C. diff. But she got C. diff. I don't even know how for sure she was exposed. She just literally got it one day. I did have a foster dog that could have brought it home, but her immune system was out of balance because her gut wasn't good. And then she got C. diff. Bam. Have you seen this happen a lot? I mean,
it's getting, unfortunately, there was a peak. So Clostridium difficile, C. diff is like everyone's worst nightmare. Dog, cat, person. Horrible. There was a period of time, probably about 20 years ago, when they were adding something called trehalose, which is a type of synthetic sugar, to hamburger meat.
Whoa.
And lo and behold, trehalose selected for Clostridium difficile, or C. diff, in the gut. So all of a sudden, there truly was an epidemic of C. diff in humans, and we started seeing it in pets because it is one of those zoonotic, meaning it can spread from person, usually from animal to person is what we're worrying about. But in this case, it was spreading from person to animal. So it's nasty and horrible to have. And the difficulty is that you can take the antibiotics, get rid of the C. diff if you're lucky, but you're still not well.
Well, and, like with Darla, I keep using her as my example because I've learned the most from her. Besides you, Darla's been my biggest teacher.
Right on.
But, we decided to not go the antibiotic route. And part of the reason I'm with Legacy Biome today is because I believe in them so much and the power of FMT, because when it came to Darla, the antibiotics weren't going to cut it. I was afraid it was just going to knock her microbiome out of balance even more. So I chose to not even go there with her, because it seems like a lot of these C. diffs and these gnarly infections the Giardia or like even like a intestinal corona are becoming antibiotic resistant. What's your experience with that?
Well, and that's it. I mean, so the difficulty is so you just mentioned a virus, the coronavirus. You mentioned Giardia, which is a cyst, and indeed, anytime anybody saw Giardia, they threw metronidazole at it, and indeed, we created antimicrobial resistance to it. The thing is that honestly, if your dog has C. diff, you, the pet parent, can go straight to FMT. Humans can't. You have to have failed antibiotics at least once, and then you have to beg, borrow, and wheedle with your GI doc to send you for either a fecal transplant via an enema, or now, thankfully, the freeze-dried capsules, the poop pills, are more available. But it's still, there are such stringent controls by the FDA on fecal transplants for people in the United States that it is very difficult to use that modality. So Darla was lucky, and you made the right choice.
Yeah.
So during that epidemic of C. diff, the American College of Veterinary Internal Medicine actually had to come out with a position paper on what to do with C. diff. And so their position paper was try metronidazole. If it fails, then try binders and probiotics. If that fails, then do fecal transplant. And at that point, this is the Wild West, right, of fecal transplants. This is when Dr. Margot Roman was just getting started, and here she is teaching all these internists how to do fecal transplants.
Yeah. She was like, you just take poop from one and you I mean, it wasn't that simple, but she was having success with that.
Right. And she had finally started poop banking, so to speak. And this is where finally there was a reliable source of clean donors, which is incredibly important whenever you think about fecal transplants, to make sure that the donors are giving material that is going to actually enhance the quality of the receiver's microbiome.
Well, I'm a little perplexed with this whole antibiotic usage when it comes to C. diff, because there's been, I guess not a warning, but there's been a heed caution that antibiotics can lend themselves to a C. diff outbreak if your pet is prone to it, or I guess even in humans. But yet we use metronidazole, which is a testable antibiotic, to treat it. So it's like...
And this is the thing that's really interesting. So if you've had C. diff once, and I think this works in our pets as well, you are very likely to get it again if you get really stressed or something else that suppresses your immune system. And so there are specific antibiotics that, if you have had C. diff, is very likely to open up the gates of hell and let these buggers back out. And so clindamycin is a typical example. And that's where if you, the pet parent, has had a dog with C. diff, you have to be very cognizant of that. And so it's super easy. You just Google antibiotics that are contraindicated with previous C. diff infection. Yeah. But ideally, what you would do is just do the work on the gut. If you use FMT if your pet has had serious GI disease, to help bring things back into balance, and realize that this is not, it's going to be better in 30 days. This is a 6-month to a year-long project.
Right. And it really was with Darla. But I do say that, Legacy Biome FMT for us was a real turning point. We did, I believe 60 days worth of it. And when we first started it, we did double the dose to really kind of knock it out. And I was doing PCR tests like crazy because, the hand washing and the wearing of the gloves when picking up the poop, and trying for her to not spread it to the entire family. Because C. diff can live on surfaces, everyone. It can survive on surfaces. Dr. Ruth's going to tell her story about that soon. And trying for, so we kept doing the PCR test, testing the stool. And luckily, within 9 days of doing twice a day FMT, she tested negative. Woo-hoo. And you know what? Yeah. Whew. And I have to tell you, she hasn't had a diarrhea or a bathroom issue since. She's had plenty of other things going on, but not,
But
thank
not
goodness.
that.
Yeah, not that, thank goodness. But I want to go back to what you said earlier about how lucky pet parents are to have this. I think sometimes I tell people about FMT and they're like, oh, but that's poop, or give my dog poop. No, no, everyone. I want you to understand, and this is what Dr. Ruth is going to help us understand too, that FMT is taking a healthy microbiome colony and community. We take out and we filter all the solids and we put it in a happy little pill. So it's not necessarily poop. It's the microbial community, and transplanting it into your pet's microbiome. So where it can colonize and engraft and help your pet's gut start to revive. It's like all of those that were on vacation, the good guys that were kind of not doing their job. It's like giving them a boost. It's like, here's your little like cocktail of like upper, and it kind of resets the whole thing. And so
Right on.
you actually had C. diff, Dr. Ruth. And I mean, what was your, I think this is fascinating what you had to do as a human to get through when this is at our fingertips if we need it for pets.
Right on. So I actually have had C. diff 3 times because I am a glutton for punishment.
Oh,
And
oh no.
and this is it. So I mean, you overwork, you overstress, and I would overwork and I would overstress, and then boom, IBS. Was it just diarrhea? What was it? So the 3rd time, I was actually in astounding physical condition. I was a bodybuilder, but I was working my butt off and was exhausted, frankly. And started with IBS symptoms, and it just got worse and worse and worse. And here's the thing: I went to the doctor's office. Oh yeah, we'll test you for C. diff. Well, they did a stool culture test, not a PCR test. I go to the emergency room a week later because I am really sick. This is right after Thanksgiving. I cannot move. So I'm there. They're like, yeah, the C. diff test was negative. And I don't know, they gave me, I can't remember, probably they gave me ciprofloxacin or something. Didn't even give me fluids after, it was just nuts. And so I'm not getting better. I'm not getting better. In fact, I'm getting a lot worse. So guess what? Ciprofloxacin is one of those antibiotics that tends to unleash the hounds from hell. And so it got worse. And then finally, 2 weeks later, I get in to see a GI doc because, this is the absurd thing, right? I have screaming diarrhea for 2 months before I can get to see a GI doc.
Yeah,
right? Oh, yeah, you probably got C. diff. And so, in the meantime, I had realized that, they just did a culture, and that's not standard of care. It's not even standard of care in veterinary medicine.
No.
So we get there, she does the PCR test. Yep, you got C. diff. And what do I get? Metronidazole. And what happened? I got better, but I still had a lot of symptomatology. So what do I have now? Now I have IBS. And actually now I have SIBO. And so this is the nuts part of it, right? So we can't treat you for anything until you have a colonoscopy. Colonoscopy. This is an upper GI disease. A colonoscopy is not going to say diddly. Okay, can you do the colonoscopy and upper GI scan? Well, we'd have to close the appointment that you've already got, and it'll be another 8 weeks. And I'm like, fine.
Oh my gosh.
Just let's do this. And lo and behold, after the gallon of Go Lightly, I actually felt better for 3 days because I dumped my entire microbiome in the toilet until
chuckling at that, but oh boy.
But no, this is the level of ludicrousness of what's going on. And unfortunately, I'm saying this all tongue in cheek, but this is also what's happening to our pets when they go through the conventional channels, right?
Right.
So I'm better because I've dumped my entire microbiome into the toilet, and finally, because my I have SIBO, small intestinal bacterial overgrowth, which is a whole nother story. My bacterial counts are down, and I feel decent for 2 days until I start eating again. And then all the symptoms come back. So finally, we get the results back from that. Finally, they start me on a medication called Xifaxan, which is designed to drop the bacterial counts down, and it is an antibiotic, but it's not absorbed systemically. So I'm on this drug for 5 years. And by the way, if you have SIBO, you really don't do well taking probiotics because the bacterial count's too high, right?
Right.
So I finally titrate myself down. I am eating keto so I can minimize the symptomatology. And what we were talking about is I go to Slovakia to get a fecal transplant because I'm living in the EU and it's available. And for their guidelines, I meet their guidelines. I have chronic GI disease of 3 years duration that has failed multiple treatments. So the cool thing is we go there. It's at this point it's infusions via enema, and things start to get better. And 2 weeks later, we're walking through the streets of Zagreb, and I experienced a trauma when I was a child, and that probably plays into all of this stuff. But for the first time in my life, at the age of 59, a guy bumps up behind me, hits my shoulder. I have lost the stranger danger radar I have carried with me for 50 years. Nuts. Absolutely nuts.
That's mind-blowing to me. How the gut-brain connection. And you said something, I think we were talking on your podcast actually, about how if someone gets a concussion, it will knock their IBS or IBD right back in.
Right.
Can you explain that for listeners a little bit?
Yeah, I mean, this is really frustrating. But here's the deal, is that there is leaky gut and there is leaky brain. And what that means is that very fine membrane that divides the brain from outside to inside, literally, can be leaky as well. So if you have chronic depression, you have something that creates chronic inflammation in your brain like Lyme or mold, or a concussion or traumatic brain injury, you can have this interplay between the endothelial layer in the brain and the endothelial layer in the gut, and they play off of each other. So if you're cruising along, everything's good, you eat something, you get Montezuma's revenge, you get a bacterial problem in your gut and you blow your guts out. If you've had leaky brain in the past, you can have that recur as well, and vice versa. So remember, there's something like 90% of our neurotransmitters of our dogs, neurotransmitters of our cats, neurotransmitters produced in the gut.
Isn't that
if the gut ain't working, the whole system is not working properly.
Right. And we found so many dogs. It seems like I can't imagine how many that you have treated, but even in my own client pool, the amount of dogs that have allergies and anxiety together at the same time.
Leaky gut, leaky brain.
That's right. That's right.
Yeah.
So again, how lucky are we that at least with our pets, we have this wonderful company like Legacy Biome, that one of the things that's most important to me is their quality and how Dr. Margot Roman raises her dogs and what she feeds them. She's feeding them a clean, whole foods diet, and really make sure that their paws are in the ground. They're happy. They're playing. This isn't just like a poop farm where, she's kept around in cages so that they can get their poo. That's not how it goes. And I know it made a tremendous difference for Darla. And again, that's why we're here today, because I think it's such a fabulous tool. Maybe fabulous is not the right way to put it, but such a great tool for pet parents and holistic practitioners and integrative practitioners to have in their toolbox. I mean, when you were in practice, Dr. Ruth, I bet you wish you had it around, because...
Oh, golly, yeah. I mean, because of what I was treating in practice was all of this horrible chronic disease that had failed at the local veterinary ER and the internist and the specialist and all of that. And we were using everything, starting with food, because that is the most critical. Supplements and all the stuff. I mean, that would have been a game changer for so many dogs. And the way that it's available today, the impact on the dog's quality of life is zip. It's super simple. Super simple.
Yeah, and to think, I mean, we can do it rectally in like really severe cases. And in fact, Dr. Margot Roman recommends if you are able to do it, do a course of ozone rectally first if you've got something like C. diff. And then FMT is possible to do both rectally and via capsule. Well, Darla, we just did a little ozone up the tailpipe, and then we did the capsules, and that's kind of what took care of it. Why do you think that FMT can become, I guess, mainstream? Do you think it's still considered an alternative? You were mentioning.
Yeah, I mean, yeah, absolutely. It is, I think it is alternative in most people's minds because of the level of difficulty to have that therapy on the human side. And because of that, because it's not mainstream there, like we hear about it periodically, I think that's why it's not top of mind awareness for most pet parents. The thing is that we live in an incredibly toxic world, and I would wager that 80% of the dogs and cats at the age of 2 already have leaky gut or some version of it. And many of them have experienced some condition in their lives that have required antibiotics at least once, maybe multiple times. And we know that it takes a minimum of 2 years for the gut to recover from a single round of antibiotics. Yeah, so it's tough. I mean, and there are ways to sort of support through that, but most of the time it's like, oh, my dog just had antibiotics, I probably should give it some probiotics. And then interestingly enough, that actually slows down the recovery of the microbiome. If your dog or cat is not already taking a probiotic, you're actually doing more harm by adding it in the middle or after the treatment.
And that's just because it's more adding to an imbalance because we're just beating one strain. Is that the thought behind that?
Well, I think there's a couple of ideas there. So even with like a 12 strain, we're pitting 50 or 100 billion colony forming units against 30 trillion organisms per cubic centimeter of poop.
Yeah.
I mean, that's just not a fair fight.
No.
So you may see what happens is it may select for those organisms, but it doesn't rebalance the diversity and the richness that's in that microbiome that's been just knocked way back with that round of antibiotics.
I know. It seems, what would you say to pet parents that are like, yeah, but the antibiotics made it better? And I think in a lot of cases they do. I mean, I just had a client recently, and she doesn't care that I say this, but her dog woke up with diarrhea, and she had some metronidazole on hand, so she just was like, "Oh, I gave it," and the diarrhea stopped. But
and it does.
It on the road,
right? So, and there's a couple of reasons that metronidazole helps. Because it also suppresses inflammation. But there's actually a recent study that came out within the last year showing that the outcome 6 weeks later between a dog that's taken a round of metronidazole versus a dog that was given only probiotics is exactly the same, except that the dog that had probiotics has its microbiome diversity and richness intact. And the dog with metronidazole has had its microbiome just flatlined.
Fascinating. I'm going to have to read that study. I haven't read that one yet. I'll have to go dig that up.
Dig that sucker up, yeah.
I'm going to. I love this kind of stuff. I'm like, ooh, dig in. Well, because I feel like they've all gotten it. I mean, Darla got metronidazole when she was a youngin' because she was a rescue, and they're like, oh, we don't know what she's had, so let's throw some metronidazole at her just to like clear everything out. And it's the wrong move.
Yeah, exactly so. I mean, really what the right move there is to look for intestinal parasites and or preemptively deworm, and that's controversial at this point. And then work to build a microbiome instead of destroying it.
Yeah. What do you think is the one thing that you would want vets to know that could maybe like shift their understanding of how we're going about these gut issues? And they're chronic, they're epidemic.
And that's precisely it. So, I mean, I think if a veterinarian stops and thinks about the last 5 dogs that she has diagnosed with IBS and how those dogs have progressed over the last several years, I think that she, the veterinarian, will realize that, well, first it was metronidazole, and then maybe it was Tylad, which is another antibiotic, and then it was steroids, and then it was steroids and budesonide, and then maybe it was steroids and budesonide and cyclosporine or some other immunosuppressive drug. And then all of a sudden the dog has cancer, or the cat has now small bowel lymphoma. And so when we are able to get enough perspective to think it through that way, then there are connections that are able to form versus like, oh, golly, Missy has diarrhea again. What am I going to do to help her feel better? And that is the intent of veterinarians. We all want our patients to feel better, but many of us do not have the luxury of time to gain their perspective to understand how the first dose of metronidazole led to that small bowel lymphoma in a cat.
Wow. And that's I guess we're going to get there. We're going to get there. We have to. And that's part of the reason that, you're doing what you're doing. I'm doing this here because if we keep going with the education about how the gut really works, how it's connected to so many chronic illnesses, starting with IBD, which is running rampant. I think every single client that I've ever worked with has gotten some level of IBD. And it's pretty hard.
Them or their dog?
I know.
Right?
I should say their pet. Yeah, their pet, and maybe possibly them too. They're so often connected. So I think we're gonna get there. We just have to keep jumping. Do you think that the pharmaceutical industry is playing a role in this, like with the drugs? I mean, I don't even want to get started on humans because we're talking about pet health, but.
Well, I think like we'd like to see a big conspiracy going on. And I think that the pharmaceutical industry is really good at making money. And also they're good at helping develop flow sheets for treatment plans. So if you have a hammer, every problem is a nail. It's that concept. Instead of saying, okay, maybe we could use a few crescent wrenches to help address this problem.
Mm-hmm.
Maybe we could start looking at some other tools, and that's the difficulty. So to some degree, medicine changes incredibly slowly. Like by the time a new textbook is printed, that data is 10 years old. And our knowledge base is increasing at the level of what ought to happen is every 6 months, probably protocols have to be reviewed and changed, but that's not happening. And so is it the pharmaceutical industry? They're not helping, but also it's the way veterinarians are trained and the way that information is disseminated. Many clinical veterinarians get their new information from their drug reps or at local meetings which are sponsored by the drug companies. So they are doing a better job declaring kind of who's got a vested interest in what topic, but still they're getting a very slanted view of the information and the research that's available.
Right. Right. Well, and I want to emphasize for our listeners today, I want to make sure that you go home with some tips from the amazing Dr. Ruth and from me, because she's been through it for 30 years. I've been through it for 10. Yeah, that counts a little bit, right?
It does. It does. And 10 years in dog years is 70 years, right?
Yeah. Yeah. I mean,
If we do that math.
Yeah, that's a lot. That's a lot of experience. But I also want to look at one thing that is standard to go about treating. I can't say treat, but Dr. Ruth can. IBD, and that's prescription diets. As a canine nutritionist, I want to give you my tip on this. Try something like the CrockPet Diet or even Dr. Judy's Pup Loaf for whole fresh food, because the three that shall not be named, but they start with RC, PP, and SD, aren't going to cut it. They're hydrolyzed food, and so in a lot of cases, then the body can't recognize the protein. But again, it's kicking the can down the curb, right, Doc?
Right. And that's the difficulty, is that, yes, the protein is hydrolyzed beyond a size that the immune system can recognize. But the issue is that the base of the diet is still ultra-processed carbohydrate, which is going to exacerbate that gut problem.
Right.
And if you feed if you feed any diet for a long period of time and you have significant GI problems, then eventually that dog, that person, that cat is going to develop sensitivities to what they've been eating for the last 3 to 6 months.
True.
And now you're back on that same roller coaster ride of, oh my God, my dog has screaming diarrhea again. And I haven't fed it anything but the prescription diet. What do I do now?
Right. And that's kind of the monster that is leaky gut, and why it's so important to get in there and start to support and heal the gut with something like FMT, because it is going to come back. And I have noticed just from experience, and what Dr. Ruth is saying is, when you have leaky gut and the body starts to form an antibody response against everything the pet may be eating or is exposed to, because that intestinal lining that she was talking about gets so inflamed, then the body's like, oh, it's an invader to everything that they're exposed to. So by switching it up, it keeps the body guessing a little bit. And also, they're not going to be eating the same like multivitamin and crackers in a vial. We don't do that. So we wouldn't expect our little munchkins to do that either. So, really what we like to see is, if poor pet is dealing with IBD, with allergies, or with a C. diff, there are different approaches a little bit, but fundamentally, it's the same. Remove the triggers. Get in a whole fresh foods diet. Drop, questions in the comments. You've got one. I've got it. I can send you links to Dr. Ruth's CrockPet Diet. That's a great place to start. And we're removing the triggers by also doing some testing to see what the food intolerances might be. Getting an FMT on board, because we're removing and we're re-inoculating at the same time, and starting to make the gut, oh, hi, we're working as a community and we're bringing the good guys in to go to work. I did a podcast about how it's a parking lot and the good guys have to get to work, and if the bad guys are parked, then the good guys can't go to work. Anyway, I digress.
I love that. Yeah, right. And that's exactly it. I mean, so there's things that you need to remove, and then you also, in the case of SIBO, you need to be paying attention to how your pet responds specifically to starchy carbohydrates.
Mm-hmm.
So that's where journaling can be incredibly useful, because sometimes we're making 4, 5, 6 changes in the course of 2 or 3 weeks, and we lose track of what happened when we did this. So I think journaling is incredibly important. Whole food diet, I think, is the best way to go, because you have absolute control over what's in the diet. And I think whether you're doing, the original CrockPet Diet, Dr. Judy's Pup Loaf, whatever you're doing, you need to know what to take out. And so that's where using some sort of Food sensitivity tests can be incredibly, incredibly helpful. We've been using Glacier Peak's Pet
Right.
Wellness Scan because it's simple to do at home. It's a hair and saliva test. Is it gold standard allergy testing? No, it is not, but it is an incredibly useful roadmap and very reasonably priced. So this is this is your guide to figuring out what your pet can and cannot handle.
Yeah. And maybe I'll work on a written guide so that our listeners can maybe have something a little more concrete. So we're gonna get there. I know it, one pet at a time. We're gonna help them, and I know it. I know it can happen because Dr. Ruth has seen it happen 100,000 times over. Maybe not that, but you've helped a lot of pets get through this.
Yeah, and the cool thing is that there are veterinarians across the country using the original CrockPet diet that I'm just now finding out about. But they've been able to have incredible success for their patients because they said, I don't know how to do it, but here, use this. And they trusted it because it is complete and balanced for all life stages according to AFCO standards when you use the appropriate supplements with the diet. And I think that's important because so many of these pets that have had chronic diarrhea for whatever cause, whether it's a pathogen, whether it's IBS, what have you, they are undernourished because they cannot absorb the nutrients from the food or supplements or anything like that. So I think this is so critical to get them the nutrients in the most easy to absorb and assimilate into their body's format.
That's right. That's right. And that's a good way to move forward. Just real quick before we go, because I want to touch on one more thing. And it's FMT and SIBO. So far, we are, even though the FMT does open in the small bowel, we are finding that because it's a community and because of how it is engrafting, that it is not exacerbating SIBO. And it's hard because there's really no standard test for SIBO in pets. I mean, they can do is it the methane breath test?
Methane breath test, yeah.
But not very many vets have it. And it's like, what do you do with your pet? Like, here, blow, you know?
Yeah. So, and that's it. So, I mean, this becomes almost what we call a diagnosis of exclusion. But this is really interesting because early on in the FMT treatment protocols, you were supposed to take it by enema because it could increase those bacterial counts in the small bowel. So this is awesome to hear that because of the way things are being processed and presented to the patient, to the pet, it's not an issue anymore. That's fantastic.
Right. So, I mean, there just really is no drawback to FMT. I mean, the more research I do about it, I learn more about it every day. It really, again, I'm going to emphasize what a fantastic tool is. And as we kind of wrap up here, I want to emphasize again that yes, investing in an FMT, investing in a CrockPet diet or a whole foods diet, is it going to cost you some money? Yeah. But at the end of the day, how much is it costing your pet and you to keep going with antihistamines or allergy shots or antibiotics and this can cost thousands of dollars a year. And this is something that can really help get to the root. And we're going to start healing at the gut level from the inside out, because that's where true change really starts to happen. And it's not going to happen overnight. It's not. Yep. It might take a couple of months. But I can tell you from experience that when you get to the end of those couple of months, you're going to have a different pet. I did, at least. What you think, Dr. Ruth?
That's the whole goal, right?
Yeah.
So we have shifted our thinking from how long have our pets lived to how long is their health span. And if they are healthy, their quality of life is going to be exceptionally high. Versus a dog that suffers for the last 4 years of its life on all of these chronic medications. Yep. That's the game change right there.
Yeah. Anything else you want to leave our pet parents and listeners with today, Dr. Ruth? This has just been amazing.
Oh, thank you, Melissa. I mean, it really is. We always have fun conversations. Here's one other thing I want you to remember is that, yes, there are physical changes that happen when IBS or some of these other chronic gut diseases are present, but they're also related to chronic stress clearly in humans, and I think that they are for our pets as well. Now, you might think, oh, my dog just lays on the sofa all day and then I come home. Well, how can he possibly be stressed? The deal is this, is that when you walk through the door, you've had that horrible, awful day at work because your boss is a jerk, and then that other idiot that got in front of you on the ride home, he or she feels that when you come through the door. So take a deep breath outside in the yard, shake off the day, and come in the house with as much love for your dog or your cat that they are going to show you when you walk through the door. And I think you're going to start to see their stress levels drop, and yours will too.
Yeah, I love that. Thank you so much for that tip. And will you do me a favor? Can we have a whole nother show sometime soon on just the gut stress brain thing? Because
I
you're
would
my
love
favorite
that.
person to talk to about that and how it's connected with their people. I have a personal experience with that too. When I had a meltdown, so did my dog. But
Dang it.
Dr. Ruth was huge in helping us both through that. So I appreciate you and your experience so very, very much. Everyone for listening, thank you so much. We'll see you on the next Legacy Biome podcast. Again, if you have comments or any questions, put them in the comments or send us an email, melissa@legacybiome.com. And we'll see you next time. Positive vibes.